there's no real good way to segue into this, so I'm just gonna do it.
Well,
You want to
there is
burn
a good
something
way.
down?
Norma
there-
always has the best way.
there is a good way to segment this. Okay, so Supreme Court recently made the decision about like the whole COVID or vaccine mandate, but for healthcare workers, and that has stirred up a lot of unrest, even causing a strike. Another one.
This isn't your average run-of-the-mill Kellogg strike. This is a United States-wide nurse strike. Like, these nurses that are going on strike are pissed about.
Good. And they should be.
Oh, absolutely. Like 12 plus working hours, almost 7 working days a week. Like, are you fucking kidding me? Right now they're struggling with worker shortages and burnouts. They've lost about 540,000 jobs between February 2020 and September 21. The union is also calling on the Center for Disease Control and Prevention to strengthen the isolation recommendation for healthcare workers and the public, adding that the latest guidelines are motivated by employers. Because remember how it went from like, oh, hey, remember those 10 days of quarantine? Yeah, 5 is fine. And then they went back to 10.
Well, that's because Delta Airlines asked for it.
And the nurses, the union is also calling, shoot, hold on. I had it just here in the thing. They're saying that all the recommendations that are being made for the pandemic are pro-employer instead of pro-employee, and they're demanding that be changed immediately, which I can agree. Every single stipulation that I've seen come out, except for, okay, maybe not every one of them, a few of them, have been very pro-employer instead of like pro-employee. Like, we're all fucking people here. How's about we protect all of us instead of trying to protect the economy? Like, the economy's already falling. It's already failing.
One thing I've learned in our anti-work is HR is not there to protect you. HR is there to protect the company.
100%.
Yep.
And that's what's up.
I'm also an anti-work. Great subreddit.
Hey, everybody needs to work, man. It gives your life purpose. The problem is people need to find work that give their life purpose.
And for a lot of these nurses, like, this was their purpose. But, you know, with the rise of hospitalizations, like right now in Texas, bed utilization I saw earlier today was at 88%. Like 88% of hospitals are full. We shouldn't be at this level. We should be lower. And I understand that we're still going through our Omicron wave. In the UK, it's already seeing how the Omicron variant is disappearing and the Delta's coming back. Like, we need to stay on top of this. And we need to treat our nurses with more respect.
We do. And I think I'm not fully versed in their demands of the nurse strike or why they're fully on strike, but I would think that some of the vaccine mandate for healthcare workers, like you're probably going to have a lot of nurses that are willing to work but don't want to take the vaccine. So you'd rather have that mandate than those nurses.
Yeah.
And that's the feel that I think a lot of people get. Like, you'll rather have that control than actually work on the problem.
I think too, like, it's just been really tough. Like, for example, a really blue state, California, their governor required vaccinations for healthcare workers since like August, and their vaccination rates have definitely gone up considerably. But with this variant, I mean, it's not just staffing shortage, it's equipment shortages, it's bed shortages, it's much needed equipment to protect the nurses. Like, even if unvaccinated, like, they don't have the necessary equipment to protect themselves. Like, most people who go into that job don't go into it for the money, right? Like, you know, it's long hours. you know that it's a tough job, but you're there to save lives. And when you get to that breaking point of like, gosh, these nurses already work weird shifts, 12 hours a piece, but when you do that consistently for going on 3 years now, or 2 years now, like that's tough. Like any person would break from that. And like even like Alan was saying, like our bed utilization is like 88%. Like even like in our county, like our positive test rates are like way up. The last 2 weeks, like we've had in our county 68 deaths from that. Across the U.S., 150,000 are hospitalized. Like that's a large number across the U.S. for COVID related issues.
And that's not even bringing up the equipment, the PPE equipment shortage that's still been an ongoing issue for nurses and for other hospital staff.
But I mean, we've had a supply issue on those items since the beginning of the pandemic. My question is, what have we done? What has any governor or any official done to help alleviate that? Have they funneled funding to a mask plant here, or a gown plant, a glove plant? Like, have they tried to build jobs plus to solve the supply issue?
No, they really haven't. That's a good fucking point too.
Just like, remember that it was a brewery that started making hand sanitizer when it was like completely gone. Like, what about like opportunities like that? Like, shouldn't they give like a grant or like a tax break to companies that are wanting to, like contribute more?
Like that. Okay, if they threw Trojan a tax break to make gloves, you don't think Trojan can do it? They probably have it up and running in a week. You know what I mean?
Yeah.
Like 2-3 weeks. They're producing gloves.
I can already hear their oh my god, their slogan. Why trust someone else with your gloves and the people that you trust to stop pregnancies?
It won't break.
And I think, the current administration approval ratings have been really bad since October. And I think that's when a lot of this wave started. And that's because people see like the monoclonal antibodies. Putting the government in the middle of that, I think, was a horrible plan, right? Because the states that wanted them and were using them had supplies. They were getting it. The states were doing it. Then the federal government stepped in and said, well, we're going to manage it and we're going to disperse it how we see fit. And that right there caused a supply shortage.
Yeah.
So again, I think the only way for any governor or any official, president, whatever, right now, is to start getting out of the way and let people make masks. A mask plant probably is not that hard. Like, we probably could have built one if we started at the beginning of this already.
Yeah.
But too, where are you gonna get the materials to make that mask? It's what, paper and cloth? We're already running out of trees.
I don't know. Hemp? Colorado?
There you go.
That's a good point. Yeah.
That's a great idea.
Well,
I mean, there's a lot of solutions, and I think that's why we're in so much turmoil right now on a lot of these items like this, is because there's solutions that the common everyday man can see, but nobody wants to do it because they don't want to look like the bad guy, or they don't want bad political press, or they don't want this.
Because
we need a leader to get creative, for sure. Like, proposing these ideas and bringing it out there instead of the same old song and dance of yelling at each other. Like, fucking do something. These nurses are just so strung out. I mean, I was reading a story, I think on the Texas Tribune, of this nurse. She's like, I work anywhere from 60 to 80 hours a week. I don't see my children. I don't see my husband. And then I come to work and I get yelled at by patients because there's not enough of us to go around. There's not enough equipment. And I, basically have to treat you and send you home. She's like, it's just not fair. Like, the work is not rewarding at all. And you can't blame them for that. You really can't. They're in a thankless fucking job. We went from celebrating our health care workers, singing to them in New York, to being like, fuck you guys, and what you need and the supplies that you need to do your job to make sure that we're okay. Like, if our whole health system just like shattered overnight, like, what is that going to do in terms of pandemic and then economy? Like, that's like a big thing to worry about.
And I mean, go ahead.
No, yeah, the healthcare industry, right? Medicare and Medicaid are 60% of the United States budget, right? So you just think about that right there. Of 60% of our budget that we spend money on is the healthcare industry.
Do you know that?
So for that to shatter or fall apart, it would just cascade horribly.
Yeah, absolutely. The biggest employer for healthcare personnel is Hospital Corporation of America. They have hospitals from here in San Antonio all the way up the East Coast. The second biggest one is Kaiser Permanente in California. The third biggest one is Mayo Clinic and Cleveland Clinic. Like, I used to work for a company that made it a habit of buying other companies that had technology in healthcare. Like, yeah. I know that all these companies will be affected in these massive fucking areas, and it's not going to be fucking pretty. Like, the minute nurses stop helping, or like just like this whole strike, once it gets bigger, it's going to get nasty, and we may see more deaths.
Well, the National Nurses United, that's the union, they have close to 2,000 members across the U.S. That's 2,000 healthcare workers. That's a lot. That's a big chunk. It's like the size of a small city.
200,000. That's bigger than a lot of small cities.
Do y'all remember pinstripers or candy cane stripes?
Yeah.
Remember?
So.
Yeah. And they used to have you used to be able to go volunteer at a hospital, and they would give you a special gown, and everybody knew you're a volunteer. Like, we don't even have that anymore, right? Like, concepts like that would greatly help most of these nurses.
Mm-hmm.
Yeah. He goes into, like, on the hospitals where they don't want to spend any money to train these people into things that they want to do, like, because it's just a volunteer. I mean, like, going to the hospital is such a weird experience. Like, you have your surgeon's fee, you have the hospital fee, you have the anesthesiologist fee, you have lab test fees. Like, it's all separated, number one. And number two, like, it's basically like doctors rent out like an operating room. Yeah. Or like, yeah. I'm gonna do a 3-month stint at this hospital and then move to another hospital.
Or like your physician's on call at the hospital, so they get the on call, they don't answer, they get someone else. Like, this shit's common. And when you get billed, you don't get billed by the one person, you get billed by 3.
So
yeah. Always make sure to ask for an itemized.
Yep. Learn that rule. So these nurses, like, who are they striking? Like, you're striking kind of like against like their hospitals, but like from what I read, they're kind of trying to hold the administration more accountable for other things. How can the administration do anything else beyond what's already been trying to be done versus basically the hospital protocols? Because I know the hospitals really don't want to get in between like the federal government and their employers or employees. So like who are they striking against? What's the outcome?
They're striking against both. What they want is they want better working conditions. They want more nurses being hired. They want more equipment, and they want better schedules than the 60 to 80 hours a week.
But I mean, so how would we get people to fill those positions of a highly skilled position unless I mean, I don't some of the demands, it's like, how do we meet those demands though, right? Like better working conditions. How do we make hospitals better? Or, how do we produce more nurses to clone them? Or
I think cloning is still
It's-
illegal. But I get what you're
Yeah.
getting at. Yeah.
I think it takes about 4 years to become a registered nurse.
Two.
2.
Last I remember.
Let me.
Was it 4?
I'll look up
Well,
those.
So there was another nurses strike that ended literally days before this new strike began, and that was the St. Vincent nurses strike. And they only had, I think, like approximately like 1,000 nurses under like who they were representing, and they were on strike for 10 months. And what they hold on, I'm looking up their. The hospital agreed to implement new raises and safety regulations, limit the number of patients assigned to nurses in some departments, and address staffing shortages as part of the nurses' new contract. So, like, the staffing is definitely the most important, but how do you get people to come back to these positions, right? Like, they left because either they didn't want to get vaccinated and they had to get vaccinated, or they just couldn't take the working conditions. Like, their personal life was in shambles and they had to do something else. So, like, how do you mitigate that in the middle of it, right? Like, say, okay, we have better working conditions, but we can't have better working hours until we have more people in place, but we can't get more people until we have, like, more hours to spread around between everybody else. It's a vicious cycle.
Yeah, that's what I'm saying. It sounds like a lot of this is a no-win situation for everyone involved, So, like, nurse goes on strike. Now you have a backlog. So the nurses that didn't go on strike have to work harder. You can't replace the nurses and you can't alleviate the nurses because, it's a highly trained skill, right? I don't. You know what we need? We need that thing where they put you in a virtual reality and you can live like a year in 5 minutes.
Like in Rick and Morty, that one game.
Yeah.
Yeah.
See, the problem is opening it up to volunteers or religious groups, and a lot of people aren't comfortable with that. But really, I think the only way to relieve nurses is to get volunteers in there.
In the interim.
Yeah.
Yeah.
Do we know, like, if they're having, like, a meeting or, like, a protest, or, like, are they gonna show up on the steps of Capitol Hill? Like, what's gonna happen?
They're gonna storm the halls of Congress.
So right now they don't have any plans to actually start picketing out anywhere. Right now it's in talks to approve the strike. But once the strike is approved, they will be picketing, I believe, outside their respective hospitals. That information has not been shared with us yet.
More to come.
I mean, this is a great example where, if, like, you can say they can blame Biden all they want for this thing, but how he has any effect on this, right? Like, you look at it as Congress. Congress can do so much more. Congress can say, hey, healthcare workers can't work over 60 hours, right? Pass a law. Hey, we always talk about minimum wage. Okay, well, nurses have to have, during pandemics, a minimum wage of this, blah, blah, blah. Or, we can say, as long as you're in school for nursing, you're able to volunteer or work part-time at a hospital. Like, they can loosen some restrictions and other things, but I just don't see how the president can really help in this situation.
So apparently, okay, I did a little bit of sleuthing on the nationalnursesunited.org website. nationalnursesunited.org. That's literally their URL. So one of the things that was ripped away was the critical protections for healthcare workers and the public, which is something that the CDC was kind of in control of too. But the two things that the NNU did do is they held a virtual press conference on the 13th of January. They held a candlelit vigil for the fallen nurses that same day, later in the evening, right in front of the White House. And if they're, according to the NNU president, if none of the resolutions have been met, then they will continue with further action. So right now there is no strike, but they are leading up to it.
Lose situation all around.
Nobody
Yep.
wins. Yeah.
Well, that wraps up another great episode. And don't forget to join our amazing and supportive community on Discord.
In our Discord, you can find game nights, watch parties, food pics, Dungeons and Dragons, and more. What's not to love about that? We have a little something for everyone. Head over to our website, officialmillennials.com, and you'll find more info, especially our featured gamer of the week.
Speaking of something for everyone, we have a book club. We read a book almost every month and talk through it together. We also have a special perk for our subs to discuss other books in a series called Chapter 2.
Don't forget to swing by YouTube and drop us a follow at Official Millennials. You can also find us on Twitter at MillsOfficial. We appreciate all the support, and y'all have a good one.
This is an Official Millennials production.